Okay, and the last demonstration with central lines is how to discontinue a short-term vascular device. And I'm going to show you how to DC a portacath. So that's the one that we're going to work with DCing. So again, you want to verify that you have an order to DC the central line. Again, if it's the portacath, the one central line or your PICC line. You want to go in and gather your supplies, and what you need to DC a portacath is that you need an offsite, a 4x4, and an antiseptic ointment. Oh, you'll gather that, make sure you go into your patient's room, ask the patient identifier, this is John Doe, his date of birth, and explain to the patient again that doctor has ordered to remove your central line. So with the central line, it doesn't matter which one you're working with, if it's a PICC line or the portacath, you need to elevate the patient's bed in a supine position. So you need to have it up at least 30 degrees or more, about 30 degrees. So you'll elevate that, and what that does is it helps prevent air embolisms. And so again, I would wash my hands before putting on my gloves. I would make sure that my tubing, my IV pump is shut off, and I have disconnected my tubing from that. Oh, okay. So again, what I would do first, I would open up my supplies and have them ready, and make sure I have a clean area off so I can change this. So I'd open up my 4x4, I would put my ointment on my gauze, okay, and then I also would open up my offsite. So I have my offsite ready. Okay, so I would start by picking up the four corners, and it comes off pretty easy because Mr. Chester Chest has to have powder on underneath this or he won't, the sticky stuff won't come off. So we're picking this up on the corners, we're stabilizing that catheter because we don't want it dislodging while we're in the process of moving this, because we're not ready for it to come out. So we got it all ready, and we have our supplies ready. We'll grab our 4x4, and at the same time we're going to ask the patient to take a deep breath in and hold it. So on the count of 3, you need to take a deep breath in and hold it, and while he's holding his breath, we will pull out the portacath. So 1, 2, 3, hold your breath, bear down, hold down, and you want to pull this out, one slow motion, and then cover that right away. You want to keep holding your pressure. Okay, so what do we need to do now is that I'm just getting rid of that. So if this was a PICC line and the PICC line was sutured in, we would have to make sure that we have a suture kit with us. We need that little dainty little scissors to go in underneath this, between the catheter and the skin, and cut the sutures. So, but a portacath is not sutured in, it's anchored in by that needle. So we'll hold that, and again, the reason why we have them take a deep breath and hold and kind of bear down is to prevent that air embolism. So you apply pressure with the sterile gauze, and the next thing we need to do is apply a transparency dressing to the gauze. You don't have to use a 4x4, but I do. Oops. And again, it won't look really pretty because Mr. Chester Chest is got powder on him to help keep from things sticking to him too well. So we would put our opsite over that. We would take our label off and we put the date and the time and what size of that gauge the catheter was and our name. What we need to do, we don't want to throw this away right away, is sometimes we are required to put it in a container and send it to lab because the doctor may want to have this cultured to see if anything was growing. Again, it can be with a PICC line, so having an extra suture set with you just in case that doctor requires that to be cultured. So, of course, you always want to make sure you inspect this also. You want to make sure that the needle is intact, checking the dressing. You know, you can't, with the catheter, you're not able to, you'll take that out, and again, you would want to make sure that you got all of it out. So you would inspect the catheter and make sure what is documented for the length is what you had removed with that. So next thing you want to do is you wanted to inform this patient that he cannot take this dressing off for the next he can take it off in 72 hours. So this dressing has to stay intact for that length. Okay. So again, I would clean up my garbage. And then I would, again, wash my hands. And then I'd go and document removal of portacath from the left anterior chest, the looks of the site prior to me taking it out, if it was red or swollen or bruised, you need to assess that. And then what size, what you covered, you put the antiseptic ointment on there with the 4x4 covered with the transparency, and then how your patient tolerated it. Okay, that's it.